Hey, everybody in the study group. I'm doing a quick blog on some stuff that I have put online for you guys. I think some of you know that I have a workbook that has a bunch of NCLEX questions in it. And I was able to get a lot of it scanned and put on our shared drive. So I'm going to walk you guys through where those like test questions are as we're leading into finals. That may help you guys. So here we go. Just follow my screens with me. So I'm going to switch screens, give you my application window. So here's my Google. Behind that's a PowerPoint just of Unit 13 that I was working on. But if you look right here, you'll notice that. Hey, Addison, how are you?
Hi.
Hello. How are you?
Good. How are you?
Good.
Sorry, I was getting ready for work.
Give me 1 second. I'm going to switch my headphones to my phone, my headset. Give me 1 second. Boom. Boom. Can you still hear me?
Yeah.
Okay, that's better for me too. Okay. Hey, I'm gonna really quickly walk through a little blog on how to find. So all those NCLEX questions that I had that workbook from, I got the workbook pulled apart and scanned, and so I've downloaded a bunch of stuff. So if you'll follow this with me, I'm gonna do a blog of this so I can send it out to everybody so they can find these. As we're going into finals, this will be really helpful for everybody. You can just do it on your own. You don't need my help, or you can do it whenever you have a minute. So if you look on the screen, I got my Google up. Like my Google search page up. So I'm going to go to my Google Drive, right? Go to the Google Drive. Okay. And obviously I have more crap in here, but I go to my school file, which is where all of our stuff is at. And then under the school file, you're going to find, I renamed this Nursing 1120. Now it makes sense what it is. And then, so like if you go into Unit 5, right, the current unit that we're in, go to the student files like we normally have done. And you'll notice now that dropped in there is an NCLEX integumentary system. So if you just click on it, that's the test number 16 is all the questions in the workbook from the integumentary system. So stuff that we've been studying. This is all those questions. They're not color because the data that it took to do that was crazy to do full color. But the majority of them don't require any like pictures or anything. And so it goes through everything dealing with the NCLEX. So that's that section, right? So you could download those, print them, do whatever you want. And the answers are also there. So you take all the questions, and then after all the questions is all the answers. The answers are the same. So if you go back, so like say, for instance, you do like completed units, the all the other units. So you come in here and just say cardiac. Say you want to do cardiac. Cardiac was Unit 5 in Exam 2. You click on cardiac right here. Let's see. There it is. So cardio, heart unit, Unit 5, and you go to the student file again, and you'll notice there's an NCLEX question thing there now. This one's upside down. I apologize. But when you print it off, you could turn it upside down, or when you download it through Adobe, you can turn it right side up. And again, it's the same thing. You scroll through it. So like, it has a whole host of questions dealing with just cardiac. In every section, with the very few exceptions, there were a couple that didn't match up one-to-one the way that the teachers had set it up and stuff. So I did the best that I could to match them up. But this is everything they have for cardiac NCLEX based. So it's like there's cardiac, there's sinus rhythm, there's like VTAC right there. And so there you go. So they're all downloaded now. I went crazy yesterday. I took time away from studying to basically, I just cleaned my whole workspace. Like if you look at my so let me shut this off and I'll show you what my workbooks look like now, because my workbook looks like my workbooks for this class look like total dog crap. So if you look right here, I made covers for them all. I got them marked on the backs. And then when I open them up, they're all marked and they're all put in order. And then all those, so the units are all together, all the books are together. And then all those test questions are all in my workbook by section. I just went crazy and I couldn't take it anymore. Okay, so that's what I've been working on. I just wanted you to be aware of that. I'm going to put this blog out so other people can find those questions, and that doesn't get Tana or Megan or anybody in trouble. They're ones that I've got, and that won't be cheating or whatever, but it will be a nice primer for the exam.
Oh, okay.
Okay, we cool? So where do you want to go? I'm up to, it's entirely up to you what you want to do.
What do you think? I don't know.
Well, unit 13's due first, but I think you saw my text for the Unit 12 exam or quiz or whatever that was. And if you do the quiz, the actual 30 questions, every question I saw was from that. There wasn't any that weren't. There weren't any that weren't in the test bank that they gave us
for Unit 12.
Yeah, so I only got like 89.94% out of the whole thing. But yeah, I did okay. I mean, I wanted to get them all, but there were some that I to this day, I get the answers from them because I have no idea on them.
Yeah.
So I was like, dude, that wasn't in the
So
book.
did you say?
Wasn't in the chapter.
Oh, so they were from like different ones. You didn't know where you got the questions from.
Well, no, the questions
Right?
were from the quiz that they gave us, right? The 30-question quiz, the
All of
worksheet.
them were?
All the questions on the exam were from that.
Oh, wow.
But some of the ones that I struggled with to answer from the quiz, you know, from that test bank they gave us, I clearly answered it wrong in the test bank, and I still don't know what the right answers are. So,
And they didn't let you go back?
no, it specifically won't let you look at the answers until everybody's taken it.
Oh.
For obvious reasons, obviously. Not everybody's taken it.
Yeah.
You know, they didn't want one person to take it for the team and then give the answers to everybody else.
Exactly.
So there you go. So with quiz 12, I would just tell you to answer the questions in the test bank as best that you can. Double check all your answers there, and then just go take the quiz and do your best, and then that's it. That's what I'd tell you to do.
Yeah.
I mean, I'm happy to go over with you what I got, but you just know that I only got an 89%. So,
which is still really good.
Yeah, I mean, I did okay. Yeah, I would, like I said, the one to go study with is Hala because she got like 93.5%. So, I'm being serious. She, by everybody I've heard, she's done the best of anybody I've heard so far. So, that's who I'd tell you to go talk to.
Yeah, I know.
Hey, is that a good warm up?
Yes.
Well, let's do this, and let's just go through quickly through Unit 13. I'm gonna just put the slides up, and I'm gonna let you talk me through these, and I'm gonna let you talk and talk and talk until you're done. Does that make sense?
Mm-hmm.
I'll let you talk and talk and talk until you can't say anything, and then we'll just go back and review it together.
Okay.
Are we good? Okay, let me bring this up, and you can.
Sorry,
Okay.
I'm just looking at
No, you're okay. Okay, go.
Okay, let me bring it up. Sorry, I'm getting ready.
You're fine. Don't worry about it. I'm just having apples and popcorn, so.
Yum.
I had this really fresh-looking apple on my counter in my kitchen. Dude, I literally just I nuked my bedroom for more, but again, I just keep cleaning, man. I keep cleaning shit out and throwing it out. I keep going through just like, I don't need this. I don't need that. Like,
that's funny.
I'm purging, man. Dude, I'm telling you, man, my shit is tight. Like, all my EMT stuff's I did all that stuff up the same way. Got all the binders to match. Everything looks good. It's like a totally organized. Oh, I'm like, it just, feels so good.
I need to do that.
Well, I intend to keep the Patho stuff out because we're going to see it again.
Exactly.
And we're gonna see it again. So I'm like, I might as well keep it out.
Okay, I'm pulling everything up. I guess
Okay.
I could look on my phone, huh?
Yeah, whatever.
Okay.
Could you see it on your phone? Okay.
Okay, so the 7 risk factors. So let me pull out my notes. I am so unprepared right now. I've been running like crazy.
I know you got to work tonight, so we'll go for an hour and then we'll be done.
Okay. So the 7 risk factors for skin problems, integumentary. So it could be like anything that's to do with circulation. So like diabetes.
Yep.
Type 1 and type 2. We have AIDS.
So yeah, and compromised immune system, right? Compromised immune system.
Yes.
Okay, got it. Keep going.
Then we have anything or ethnicity, so Caucasian.
Yep, white people traditionally have more trouble with their skin than darker or pigmented skin people.
Mm-hmm. There is skin pigmentation, so fair skin and light colored hair, anything like that. Exposure to chemicals, radiation, and sun. So if you're tanning.
So let me ask you a question. Can I intervene for 1 second? So
Yes.
if one of the problems that we have later on that we're going to talk about has to do with that getting too much sun. Do you remember the name of that one?
Melanoma?
Well, not melanoma. There's one that's benign. Remember, that's precancerous. That has to specifically deals with. It's called solar something, or it starts with an A, keratosis, or solar keratosis. What was the one that started? What's the A word?
Now I can't remember. I don't know.
Actinic keratosis.
Actinic keratosis.
Remember there were two benign. There's two benign types of skin conditions, and then one is not. They're both considered like cancer because they're abnormal growths, but they're both considered benign. The one that specifically deals with excessive sun is called actinic keratosis, and that one is precancerous because if you keep exposing your skin to the sun, eventually it can develop into a melanoma or basal cell, or excuse me, squamous cell carcinoma.
Okay.
Okay, I just thought I'd jump in and just spark your mind a little bit as you're looking through these. You know what I'm saying? As you look through some of these risk factors, some of these really point to specific conditions.
Yeah.
Okay, keep going.
Okay. So we got and then we have the pathogens. So bacterial, viral, fungal, or parasitic.
Yep, pathogens.
Pathogens.
And we'll talk about those in more detail here in a minute, but
okay.
So rapid fire, what are the, you can look at your notes, just rapid fire from top to bottom. What are they?
So all of them again?
Yeah, just from top to bottom. Read them out.
Okay, skin pigmentation, ethnicity, exposure to chemicals, radiation, and sun, trauma, pathogens, body states causing decreased circulation, and then body states causing compromised immunity.
Awesome. Okay, so let's talk about the next three. What are the next three?
The risk factors, right?
No, the pathogens down. We're going to jump into the pathogens.
Oh, yeah, that's right. Risks from fungal, bacterial bites, and infestations. So fungal is basically, it's all on us. Like,
yeah, it's traditionally what? What's the primary indicator for fungal?
It's any, like, if they're sitting in wet, gross.
Yep. So poor hygiene was one of the key factors, and then wet water, right? So if you had two one-liners for fungal, it would be poor hygiene and water-based.
Yeah.
Awesome. Okay. What's the next one?
Bacterial.
Okay.
Which is basically being exposed to it in a hospital.
Yeah, so we can give it to people, right? If we're not hygienic, washing our hands and taking care of the bacteria on us, we can give them to these patients, right? We can also introduce them, like when we give them an IV. If we don't prepare the IV site correctly and exercise proper IV therapy and IV setup, we can give them to them that way because we're actually physically inserting a needle into their into their venous tissue, into their subcutaneous layer, right? So that can be a problem. Okay, so what would be, so there's two main types of bacteria that we're most worried about that we're going to give to people.
Staph and I don't remember.
And staph and strep.
Okay, my mom got staph twice.
What?
Yeah.
At the hospital?
Uh-huh.
Oh my gosh, that would piss me off. Okay, and then the two biggest so this is exposure to MRSA and multiple other drug-resistant organisms are still a major problem. Examples being impetigo or superficial infection and cellulitis, which is deep skin infection. So we're going to hear about cellulitis in a minute, right? In more detail.
Yes.
But that's what's going on. And then impetigo. What does impetigo actually look like on somebody?
Superficial. So when
little kids get it. Kids get it, and they get it around their nose and their mouth. It's lesions and sores around their nose and their mouth.
Okay.
Okay. I just so that you know that, right? We may not get tested on that in this class, but I know that there's a juvenile impetigo that's very, very common, and it presents as sores on the nose and mouth. You give an antibacterial to them, and then or antibiotic, and that will kill it, and it gets kind of a gray color, and then it starts to flake off as the skin underneath it heals. Okay. So The only reason I know that is because as a child, I had that.
Okay.
It was miserable and it hurt like hell, but the antibiotics did work and it definitely relieved it and it went away. And now as an adult, I don't have it at all. I don't ever get it.
Yeah.
Okay, what's the last one? Fido and Fifi.
What'd you say?
Fido and Fifi.
Fido and Fifi. What does that mean?
And a crazy boyfriend. It's called bites and infestations.
Oh.
For you, it'd be a crazy boyfriend. For me, it'd be a crazy girlfriend. And then for everybody else, I don't know what they're into.
That's very true.
Okay.
Okay. So I'm back.
So where would we find bites and infestations? What populations are most at risk for those?
Anyone?
Well, anyone can get them, but it's people who are closely living together.
Oh, yeah.
So where are we going to see those?
So, like facilities?
Yeah, like not so much hospitals, right? Because we don't bed people in the same room, but like military barracks, like prison, right? Anywhere you have people with close proximity to each other who are actually sleeping by each other, you're going to see elevated increased infestations. What about bites? What are bites? What's going on with that?
Bites could be anyone living near like a pond. So
yeah, so we have standing water, right? And that, what does that breed? What's around a standing pond all the time?
Infected mosquitoes.
Yeah, bugs, right? So you have infected mosquitoes, flies, gnats. I mean, you take your pick, right? Okay, in Utah, what's the biggest problem with Utah mosquitoes?
West Nile virus.
Yep, and what does West Nile virus do to people?
It can lead to encephalitis.
Yep, neurologic problems, right?
Neurologic, yeah.
Yep, it's going to be neurologic. Okay, moving right along. Let's hit on these infections. Okay. Have fun. So, what's cellulitis?
Cellulitis is basically just like skin infection.
Yep.
Inflammation. Strep or staph. So let's see. Anyone, the high risks could be someone with diabetes or a weakened immune system. They could be on prednisone or other steroids.
Yep.
High-risk group tends to get sicker from cellulitis and is more likely to get cellulitis again.
So once you get it, right, you can get it again really easy.
Mm-hmm.
Okay. What are the causes?
Trauma.
Yep, skin injury. Yep, skin injury.
Medical procedures, so IVs, surgery.
Yep, your favorite thing, right? When we cut them. If we cut them, we can give it to them.
Yep.
You love the cut, so I'll just say, Addison, if you cut them, you can give it to them.
New tattoo and piercings.
Yay.
And problems with skin breakdown. Like athlete's foot.
Yep. Cirrhosis, fungal infection, athlete's foot. Yep.
Yum.
Yay. Okay. We got some new words we got to learn, right? Hyperemia and urethemia.
Swelling.
Yep. Swelling and redness. Okay. So important nursing. What are our important nursing considerations for these people? We want to take an awesome history of them.
Yeah.
We get a great medical history because it's going to tell us their allergies, and then we won't give them stuff that they're allergic to that's going to aggravate some of this crap.
And then neuro checks.
Yeah. And what the 5 Ps? Do you know the 5 Ps?
Is it pain?
Yep, pain is one of them. Yep.
Pain,
So those following along at home, okay, you know where the 5 Ps are actually at? The 5 Ps are actually at in Unit 12. Back in Unit 12 on page number 3 of the unit. So the 5 Ps are a neurovascular assessment on Unit 12. Do you have Unit 12 in front of you?
Yeah.
Okay, let's go over them really quick. Number 3, page 3 of Unit 12.
Pain, pulse, pallor, paresthesia.
That's if they can feel, right? Ouch.
Mm-hmm. And paralysis.
They can't move it. So that's a good review from Unit 12, right?
Yep.
Okay, let's keep going.
Okay.
Okay. 5Ps, do them neural checks. Okay, moving right along.
Okay.
So it says mark around the area of redness. Why would we mark around the area of redness? Why are we doing that?
To see if it like grows.
Yeah, if it grows or reduces, right? Because it can get bigger or smaller. If it gets bigger, what does that mean?
That it's growing.
It means whatever treatment we're doing isn't working, right? And if it gets smaller, what does that mean?
That it's good. We're reducing
Yeah, it's getting better, right? It's like, oh, good, it's getting smaller, great. Okay, that's say lives. Let's get into our friend. Hold on. Let's get into our friend contact dermatitis.
So it's a hypersensitivity.
Yep.
Type 4.
Type 4
leading to type 1.
So can you explain to me what that actually means when it says, hey, it's type 4, but it can lead to type 1? What does that mean?
Well, type 1 is like anaphylaxis, whatever.
Yep.
So, which is the most severe. So, basically, it's leading up to type 4, which is delayed, but then it can, it's immediately look like type 1.
Well, let me give you an example. Can I give an example?
Yeah.
So let me ask you this. So if you're allergic to bees, right? Do you immediately, like the first time you ever get stung by a bee, do you ever just like immediately go to type 1 anaphylaxis when you get stung by that bee the first time?
Probably.
Actually, you don't. You actually need multiple exposure to an antigen in order for it to develop into the most severe case of anaphylaxis, right? So like you may have a young child who is allergic to bees, right? The first time they get stung, they may actually have a delayed response. Like they'll get hives, they'll get some itching, right? Some urticaria and some puritis, right? But they won't get massive like anaphylactic choking. They won't get swelling of the laryngeal area. They may get some difficulty breathing, but they'll be able to respond to it, right? Their body will respond and take care of it. Okay. It's the second time they get exposed to it. What happens then? The second time they get stung, what happens?
Then the reaction occurs?
Yeah, then it wants to move to type 1 because what happens is the body's B cells and the memory is there now, right? That's the kicker. The neutrophils and the white blood cells that are like quick acting and then quick dying, quick falling off, those guys don't really have a memory, right? They just fight everything. It's those memory cells that are the B and T cells. Man, those suckers, they're like, hey, listen, we got exposed to bee venom and we don't like it. So, man, those guys remember. And so if that memory is there, how quickly does that kick in?
Fast.
Yeah, it kicks in really fast the second and third time. So that's when we see type 4 delayed transitioning to anaphylaxis type 1.
Okay.
That's what that actually means. So, like, for example, if you were really, really allergic to poison ivy, you may have to have 2 or 3 good exposures to it in order for your body to build up those antibodies to be present so that when you get exposed to like poison ivy or poison oak the third time, then you could normally we say, hey man, poison oak, poison ivy is a delayed response, right? But could somebody potentially get anaphylaxis from poison oak?
Yeah.
Yeah, they could, like hay fever, right? The first time somebody's ever exposed to grass or hay, they don't get massive like anaphylactic response. It's the third and fourth and fifth time that they build up a worse and worse and worse immunity to it or hypersensitivity to it. And so, yeah, and that's just that's what it comes down to, right?
Okay.
So I wanted to make sure that you understood that. So what it is, it's contact dermatitis is you're being exposed to poison oak the first time, right? You get hives, you get some itching, you get some delayed response. A couple days later, you itch a little bit, 12 hours later, you go, man, that sucked. I got some poison ivy. And then the next time you're exposed to it, if you actually have a hypersensitivity to poison oak, the next time you get exposed to it, you're going to get way faster and way worse response to it.
Okay.
And that's when you start getting closer and closer to type 1 full anaphylaxis.
Okay. That makes
okay, we good?
Sense.
Okay, yeah. What are the two big words for contact dermatitis?
Would it just be type 4?
Well, no, urticaria and puritis.
Oh, puritis. Okay. So urticaria is the raised, so hives.
Yep, just hives. Yep.
And puritis is itching.
Yep, that's it. So urticaria and puritis is hives and itching.
Okay.
Okay, so let's go through the pathology of this. Do you want to read through this?
Yeah.
And tell me what this sounds like when you read it. Read through it all, and then tell me what you think it sounds like. There's a couple other processes of the body that sound similar to this, and I want to see if you can identify it.
Okay, caused by sensitivity to an allergen, androgen exposure, mechanical, chemical, environmental, dermal inflammation response, an eruption of skin tissue related to contact with allergen or triggering substance.
Okay, so what? So like you see like steps, right?
Yeah.
What other process in the body have steps like this leading to stuff? Well, doesn't shock have steps like this?
Yeah.
So like they start losing blood. The blood now isn't getting like there isn't as much of it, and they're hypoperfusion. Hypoperfusion causes lack of like oxygen cells. The cells go into cells go into anaerobic respiration, and that stops, and then they get necrotic and they die, right? The cell dies and the tissue dies. That's like a step by step. So this is a similar thing, right? It says, hey, we introduce an allergen to the system, to the body, right? The agent exposure can be mechanical, chemical, or environmental. Okay. Like, so mechanical would be like you stick a needle in them that's contaminated, right? We've mechanically stuck something in them that's bad. What would chemical be?
Anything like drugs?
Yeah. So right? Like say for instance, someone like, so for example, hydrogen cyanide is really, really toxic and poisonous to our bodies. That would be a chemical exposure, right? Because it can go right through the skin, either as an aerosol or, you know, as a vapor. It can permeate the skin and it causes us to die, right? It makes these processes go out of control. So that'd be like a chemical exposure. And then what was the last one?
The last one is, wait, where is it?
It's on page 2 near the top. It says pathology right under the big blue bar.
So, allergen. Oh, environmental.
Yeah. So what would environmental exposure be?
Anything in the hospital.
Well, yeah. Yeah. I think they're talking here like the sun would be an environmental exposure, right? An insect bite would be an environmental exposure.
Okay.
It's in the environment, right? There's a vector or the sun. Both can lead to skin irritation and skin issues and stuff. So those things could be delayed onset, and then they cause this anaphylactic condition like poison oak would be environmental, right? You get exposed to that in the environment. That's not in the hospital, and that's not mechanical. It's not chemical. Okay? Okay, cool. Keep going.
Okay, so
then what happens next?
Dermal inflammation response.
Yep. So what does that mean?
An eruption of skin tissue related to contact with allergen or triggering substance.
So in your own words, how would you say that to me? If you were going to explain that to me, how would you explain that line?
Basically, I would think it would be like hives.
Yeah, you get exposed to something, and at the point of contact, where the hives, where the poison oak touched you, or the bee stung you, that's going to be the local site of where you're going to get hives and the redness and the sharp, right?
Yeah.
That's it. You got it. Okay. Let's go through the couple of types here. So, what does it say underneath in the big words? In the colored words?
Allergic dermatitis.
So, what is allergic dermatitis?
Allergens such as soap, latex, balloons, and gloves.
Perfume, metal, copper, silver, gold.
Yeah.
Okay, what's irritant dermatitis?
Cleaners, soap, makeup, manufactured chemicals on new clothing, many chemicals and solvents.
Okay, so yeah, so again, there are some on that list that pass. They're in both, right? So like soap is in both of them. Okay, but metals is only allergic dermatitis, right? It's not in irritant dermatitis.
Yeah.
Okay, and then what about idiopathic?
Idiopathic it says examples: itchy scalp from dryness or buildup of air products, winter itch due to dry skin during colder months.
I'm already getting that, by the way, just so you know. I have baby oil next to my freaking shower now, so when I shower, I baby oil down to keep the itch down because it's like a son of a gun.
Okay, and then interesting factoid: cold weather causes skin to dehydrate faster than heat. Yep.
There you go. Okay, so we got signs and symptoms of pruritus. What was that?
We all knew that, living in Utah.
Living in Utah. Awesome. Let's hit pruritus real quick.
Okay. Puritans is itching, reddening skin, mild scale to acute necrotic burns.
Vesicles.
So itching.
Yep.
Okay. Observe for urticaria.
Urticaria. Yep.
Which is hives, raised rash, which is often a precursor to anaphylactics.
Uh-oh.
Oh, okay.
So if we start seeing hives and itching on someone, what are we going to get ready for?
Anaphylactic.
What are we going to be going to the med shop and going getting? What are we going to the pharmacy to get?
An EpiPen.
We're going to get Epi, we're going to get Benadryl, and we're going to get corticosteroids or steroids that treat for anaphylaxis. We're going to call for all three of those things. Okay, keep going.
In which the patient throat swells. Note itching strenuously can break the skin and evolve into an infection.
Okay, so if they itch a lot, what can they do?
Break the skin.
Now they can introduce a biological or fungal pathogen because the skin's now open than when it wasn't before.
Okay.
Okay. So what's the first thing that we always look to do to treat an allergic reaction?
What's the first thing we look for?
What's the first thing that we're going to do to help somebody with an allergic reaction?
Well, obviously airway.
Well, hold on. Avoid the trigger or remove the trigger. That's the very first thing we're going to do. And that's why I pushed it, because even I was saying, oh, I'm going to get the airway and hit them with Epi and everything else. And again, we missed the most simple thing, right? Take the damn allergen away, and then your treatment will be more effective, right?
Yep.
Okay. Then what's the next thing? Then just read through them all in order.
Remove the source, lubrication, tropical steroids, antihistamines. Epinephrine is given to anaphylaxis to open the patient's airway. A tetanus shot is also given if an insect bite is suspected.
Okay, you got it?
Yep.
Let's hit the pressure ulcers, hard and fast.
Okay. Pressure ulcers. Is that one? Oh, okay, no, it's right here.
Right at the bottom.
Okay. So condition from unrelieved pressure in one area, basically.
Yeah.
Filling with blood, tissue becomes eczemic. Maceration of the skin occurs when it's constantly wet. The skin softens, turns white, and can easily bacteria.
So give me two different times in your experience where you would see maceration, either just recently in your current hospital practice or other times in your life when you've seen maceration.
Basically, if someone's sitting in a wet brief for hours.
Get back into life with Depends, except for if you leave it on too long and you get a pressure ulcer because your balls get necrotic.
Seriously.
They don't say that in the commercial, do they?
Nope.
Hey, check this out. And then what would be another time that you've seen this?
Pressure ulcers in general or maceration?
Well, no, maceration, a maceration condition.
Can
I ask you a question?
Yeah.
Have you ever had a cut on your body anywhere?
Yeah.
Have you left a Band-Aid on it too long?
Probably, yeah.
What does it look like when you take the bandage off after it's been on there too long?
Well, normally if I get a Band-Aid wet, I just take it off.
Well, I know. I'm just saying, but when you do that, right, what's going on underneath that bandage when you get it wet?
A bacteria.
They love that water and that warm skin, and that bacteria just goes right to that spot. Yep, and that's why you're exactly right. Remove that wet bandage, replace it, get a new one on there, and keep, obviously wash the site. Then you may want to, like, I'm a big believer in doing like Neosporin, that gel, because that's an antibiotic, right, as well. And that'll give you a little bit of time because it's not water soluble. And so that'll give you a little bit of time to keep that water out of there. And then you can change that out, wash all that out, put the Neosporin back down, put a nice, clean, fresh bandage on it, and you should be just fine.
Huh. Hey, I am going to go eat and go to work early just because the roads are bad. So
okay, that's fine.
I should probably go.
Okay.
But I can study tomorrow if you're available.
No, I will. Like I said, I have to work 10 to 8 tonight. We're gonna do a study group tonight at 8:30. So I'm gonna lay down and take a nap, and then I'm gonna head out to work and get there early as well, and just do the next study group from work. And then that's fine. So what time do you finish work tomorrow?
7.
Do you want me to come by your work? Because I finish work at 8,
Yeah.
so I can meet you like around 8:30. Does that work for you?
Yeah, that would probably be better than.
The roads are going to be shit
Yeah.
anyway, Addison. So you know what I'm saying? Like the longer you're staying at work, the less traffic. I mean, if you hit the roads at 8, 7 o'clock and go home, you know what it's going to be. It's going to be roadkill out there. But if you wait till 9, you know what I'm saying? The peak of rush hour should be clear. And worst case scenario, just sleep at your work for an hour. You know, just rest at work. I'll come get you, and I'll text you or call you when I get there, and we'll just hit it hard for an hour, and I'll kick you out. Okay.
Yeah.
We're getting to go time. Have you done the unit? You haven't done the unit 12 quiz yet?
Not yet.
Okay, here's what I would tell you, Addison. Do the questions the best that you can. I mean, if you, again, I would literally tell you to contact Hala and get her help on them before you take the quiz, because she did the best. And then just go take the quiz and get it over with. I'm literally telling you that's what I would do.
Yeah.
Because right now I'm not stressed. What was that? What was that?
She said that hers wasn't all on the questions though.
Well, I'm telling you right now, I just did it, and they were all questions from that dang worksheet. And if nothing else, they're 90% from that worksheet. So I would be willing to I'd be willing to bet that when you take it, you'll have all questions from that worksheet, or the majority of them.
Okay. Yeah.
Okay, we down?
Yep.
Okay. Well, have a good night at work. Yeah. I got to work too, so I'll be thinking of you.
Okay.
Okay, and please drive extremely safe tonight, okay?
I'll try.
Okay, have fun.
Okay, you too.
Later.
Bye.
Bye.